Hi, everyone. My name is Louis Bourdeau. I'm a lecturer in French and Medical Humanities at the National University of Ireland in Maynooth, and I'm here today with my colleague Avril from Finland. We'd like to tell you a little bit about our project, which is called ENDOS. It's co-funded by the European Union, and it's an initiative that is designed to educate and support adults living with chronic diseases, and particularly endometriosis. What we've done is we've been combining the arts, culture, and digital tools to really create a patient-centered learning community. And Avril will tell you a little more about this.
Thanks. Yes, I'm Avril Tynan and I'm a researcher at the University of Turku in Finland. We're working on this project together along with a number of other partners. And we're particularly interested in endometriosis, which is a painful condition where tissue similar to the uterine lining grows outside the uterus. And it affects around 10% of women and girls of reproductive age worldwide. That's about 190 million people. Yet it remains poorly understood and often misdiagnosed. And the Endos Project aims to change this by amplifying the voices of those affected and developing resources to improve communication between patients and healthcare professionals.
So now we'll tell you a little bit more about the goals of the project. So Endos has, as I said, several objectives. The first one is overall, we want to empower people with endometriosis by giving them a platform to share their experiences, because we believe in the power of personal narratives. They help shed light on the emotional, the physical, and the social challenges of this condition.
And these stories will all contribute to the creation of a narrative and emotional dictionary. This dictionary will help doctors, researchers, and patient advocates better understand the language that you use to describe pain, symptoms, and your expectations and hopes. By reducing linguistic misunderstanding and lexical ambiguities, we also hope to shorten diagnosis times.
And in addition to this, the project offers training modules for healthcare professionals, but also for patients. And we also have partners both in France and here in Ireland working to develop an app that will be called EndoStand. And the goal of this app will be to simplify medical reports. So you'll be able to scan the report and you'll get the report in lay terms, which will be more accessible. So overall, through visual and performing arts, through storytelling and digital tools, as well as narrative medicine, the workshops that we'll do with the healthcare professionals, we aim to really foster a deeper understanding of endometriosis and its impact.
Now, one of the most innovative aspects of the Endos project is the narrative pathway. And this initiative is designed to analyze and identify the vocabulary used by people with endometriosis to describe their experiences. By understanding the words and metaphors that you use, we can help to transform and positively influence the experience of living with this condition.
So that's really the key part of our project that we, Avril and I, are working on with our colleagues at DNM Lab in Italy. And this is also why we're doing this, because we want to raise awareness and we want your help, because stories that we are looking for will be collected through the platform called DNM Lab, where all the participants, you are cordially invited and you can share your experiences anonymously. The platform is user-friendly and accessible from any digital device. It provides narrative prompts. There are short, open-ended questions that encourage self-expression and they help capture different aspects of life with endometriosis. So, for instance, the first prompt is, "It all started when?" And then you get to continue that as you wish. And you'll get several prompts throughout that pathway to kind of get a sense of how you live your life with endometriosis.
And all of these prompts, we developed all of these with help in workshops from artists and people with endometriosis. And they've all transformed their experiences into helping us create these prompts into the narrative pathway, but also into artistic installations and performances. And this intersection between art and storytelling offers a unique perspective on endometriosis and its impact.
So why should you participate? Well, by participating in this narrative pathway specifically, you will be able to contribute to a broader understanding of endometriosis. Your answers will remain, as we said, anonymous. No personal data is used or collected. Your stories will help us to create valuable resources that improve communication between patients and healthcare professionals, and they raise public awareness of the condition.
Endos is a European collaboration. It involves partners in Ireland, like Loic, in Finland, like myself, but also Italy, France, and Sweden. And by sharing your experience, you become a part of this community that is dedicated to changing the way that endometriosis is understood and treated today.
If you want to join the journey because you have endometriosis, we will be sharing the link. There is also a short tutorial on the website that will give you a sense of what the platform looks like and how you can navigate that. We are doing it in 3 languages. So if you're here listening in English and you live in Ireland, you can sign up for that one. If you are in France and want to do it in French, you can do that as well. And we also have it in Italy. And then if you have peers or friends or anyone that you know in these 3 locations and you want to share with them, you can also do that. So thank you for watching and for being part of this important conversation. And if you want to stay updated on the Endos project, you can follow us also on Instagram at endos_project.
So please sign up, spread the word, and we look forward to hearing more from you. Thank you.
Thank you.